What's up, you guys? Welcome back to the Nomadic Nurse Podcast, where we talk about everything about nursing, healthcare, faith, business, career development, all of the above with glory from the God from up above. In Jesus' name we pray, amen. Now, we are here to talk about the realities of nursing and healthcare in today's society and how has it evolved since I graduated, because it ain't the same. It's not the same. And I'm going to try to pack in as much as I can in this, because this can get really, really long, because that's 13 years of experience that I'm about to lay upon y'all. And I'm going to try to pull it in the cliff notes, and keep in mind that throughout the podcast, we will be talking about this more and more and more, and I'll unfold a little bit more as we go. There's going to be a lot of inspiration that's coming out of this podcast episode, so that way y'all can just tap in and get into this. So we're going to start with the verse of the episode. So grab your Bibles, grab your word, and we are going to head into 1 Samuel chapter 30. So 1 Samuel chapter 30, and we're going to verses 6 to 8. So, and it reads, David was in an extremely difficult position because the troops talked about stoning him, for they were all bitter over the loss of their sons and daughters. But David found strength in the Lord his God. David said to the priest Abiathar, son of Amalek, "Bring me the ephod." So that Abiathar brought it to him, and David asked the Lord, "Should I pursue these raiders? Will I overtake them?" The Lord replied to him, "Pursue them, for you will certainly overtake them and rescue the people." Amen. So the reason why I chose this word for this episode is because there is a lot of difficult positions that healthcare professionals go through. So in this episode, this could be relatable to any other healthcare professional, or even if you're not in healthcare at all, could this be relatable to you? It's very possible. So just hang in tight and just replace the word nurse, doctor, PAB, PSW, replace those words with the profession that you are in, and see if this is something that can be relatable to you, because it's very possible that another profession is going through this. And what I want to emphasize here is that in the healthcare profession, it is by far one of the most physically, mentally, spiritually, emotionally demanding profession you could ever get into. And we're going to talk about how this has evolved over time. So in this verse here, it's basically talking about when David was trying to defeat the Amalekites, and his people were frustrated because the Amalekites took the sons and daughters that were under David's throne. The issue with this is his soldiers, they felt that because all of his people were taken away, including these soldiers' families, that David should die from it. However, in this circumstance, David leans into God because he's seeking strength in God. And because he seeks strength in God, afterwards, fast forward, David got his people back from the Amalekites. The people were reunited. So with that being said, the challenges that we go through as healthcare professionals, lives are on the line. It can get very scary. It can be very, very anxiety inducing. And we will get into these moments of pressure during a code. Let's say the patient is in the middle of acting out violently, or the patient's heart has stopped and we have to try to resuscitate. And these can be very anxiety-inducing moments for the healthcare professional. In that moment, it can get very overwhelming for a very new nurse, especially. It can be overwhelming for pretty much anybody, but as we go older in our career and get more experience, we end up finding ways of suppressing it or calming it down, because we know what to expect. We know how the drills run. However, there's a little side component that we don't talk about. There's a side component that I've only learned after I pulled myself out of a department. And I had to analyze this because, and keep in mind, it's not because of the department itself and how it was run. No, it's because the quality and the type of the clientele can be quite intense. And keep in mind, in this department, this ain't even the worst, because if you go in other departments and across the world, hey, you're talking about big time issues in the sense that you're going to see more graphic codes, you're going to see more gruesome situations. And I know I dealt with things lightly compared to many. I'm sure of it. So it's here to talk about holistically, how can we also understand the situations that professionals are in, how they're feeling, and what are they doing to manage those feelings, and not to mention, how are we evolving as professionals? The truth of the matter is, I had to seek God in order for me to have some type of rest. I had no choice. Like, I was in a situation where I got out of the department that I was in. I needed to pull myself out to bring myself back in. And now I didn't go back to that hospital for reasons because I went into travel nursing, but I needed to go back into the emergency room at some point, and I knew this when I pulled myself out. I knew that that was going to happen. The question is when and where. So that was something that I had to work on healing, and God really worked on me for that. But the realities of the healthcare profession, it's getting more gruesome, it's getting more difficult. It's creating an image of the healthcare professional to be bitter, mean, because of everything that we're going through. So we're going to talk about the system as well. The realities of the nursing profession, in all transparency, is you will graduate nursing school. The teachers will try to give you the best perspective possible. They'll try to give you as much clinical hours. They would want you to get as much hands-on experience as much as you can. They want you to be as hands-on, tactile as you can, because if you don't have access to those experiences in nursing school, you will get it in the real world, and you may not have as much support. For example, for me, I only started doing blood tests and IVs after graduation. I did not poke one patient in nursing school. Not one. Interesting, eh? I did not poke one patient in nursing school. I learned the foundations of nursing, but that foundation I did not have the luxury to get. And I know it sounds crazy, but it's a privilege, because there are certain things that people had exposure to that, congratulations, that's amazing, but I didn't have the exposure to doing blood work or putting in an IV in nursing school. Now, that's why they try to fill you up in clinical. They try to fill you up with as much skills as you can so you can at least see it, feel it, touch it, all that stuff. You're not going to be able to touch everything in nursing school. They will try their very best to touch on everything, but at the end of the day, even if they do touch on it, there's just so much information, so much dense information, that it will not be able to be carried through into your profession entirely. And again, I go back into the model, the education model. Oh my gosh, I love this model. It was the knowledge retention model. So if we go back to the knowledge retention model, so 5% is lecture, 10% is reading, 20% is audio visual, so YouTube visuals and stuff. 30% is demonstration, when someone shows you how to do it. Discussion is 50%. Practice doing, which is you doing it, is 75%. And teaching others is when you understand 90% of it. And this is like an approximation, right? But I'm telling you, you will not even hit even if you've seen every single thing in your nursing school life, you will not be able to do certain things that will get you to the 75%. I have spoken about blood tests all throughout nursing school. We spoke about it. Did I do it? No. So therefore, I only retained 50% of that knowledge base, right? You're going to graduate nursing school. You're going to go into the profession. You're not going to know everything. If you're lucky, you will, if let's say you learned every single thing in the nursing profession, you will only know up to 50% because you've only discussed it. If the things that you've actually practiced doing, and there's practice doing on dummies, and in labs and skills lab, and then there's practice doing on actual patients. As much as they try their very best to make it as realistic as possible, it's still not entirely the same. The dummies don't have real skin for you to actually go feel the vein. It's as realistic as they can make it, which is very appreciative, but again, it's still not the same. The patient's gonna fidget, the patient's gonna move, the vein's gonna roll, things like that. I'm using blood tests as an example, but you're gonna graduate and you won't know everything. But here's the beautiful part about all that. Here's the beautiful part. That is okay, and that is what everybody went through. However, you have to seek your knowledge to then develop your wisdom with the experience. You need to seek it. You need to go out and get it. You can get it 90% and get a 4.0 GPA. I'm going to tell you something, you will still not know everything. You will not. It is okay. It is fine. Try to seek it. Try to dig for it. But now we're going to get into the realities of it. When you get onto the field, you will be so confused. And what I mean by that is the healthcare system is not what it seems. There's one thing for you to learn how to be a nurse in nursing school. It's one thing for you to learn how to be a nurse in nursing school. There's another thing for you to learn how to be a nurse in the system. Two completely different worlds. How to be a nurse in nursing school will teach you the ABCs 1, 2, 3s of nursing. It'll teach you the entire structure. It'll give you the best foundation that it knows. And sometimes it may not be up to date with the system. And the reason why it may not be up to date with the system is, for one, the system is not up to date itself, because the system is falling into a path where we are cutting corners to provide care. Hence why when you go back to nursing school, you're going to be shocked, because you're like, wait, I'm not allowed to do this in nursing school. I would have gotten in trouble in nursing school. Yeah. But here's the thing. This is what we're stuck doing. We got no other choice. This is where we're at now. We are trying to keep people alive now. That's the system that I've worked in for many years, where we're in a part where we have to find ways of keeping you alive. And that is so scary. And it's just getting worse and worse and worse and worse. It has gotten worse since 2014. The truth is, how are you going to cope? The reality is, you better go to therapy once a month. Why do I say that? Is because you're going to see people that are very sick. There will be people that you will feel moral injury because there's things that you know what to do, but you don't have the resources to do it. And you will go through these moral injuries, and you will have to find ways of dealing with those emotions, because there will be nothing that you can do until one day you become so apathetic because you realize, well, there's nothing I can do, and you feel hopelessness and helplessness for your patients. And it makes much more sense for you to shove it under the rug and just be like, it ain't my problem, and it becomes a job. And then all of a sudden, the beautiful profession of nursing, the beautiful profession that you are in, is no longer a purpose, a calling, a gift of healing. It becomes a job. And that is the issue. I understand that this is a job. And that is another thing we are going to talk about. I understand that this is a job. But I also understand that this is a job that not anybody can just do. This is not a job that anybody can just pick up and say, oh, I'm gonna do this. No, it's not. If y'all think that's what it is, y'all are highly mistaken. Come to the ER with me one day and let me know how that goes. Go work on a med surg floor and let me know how that goes. Go work in ICU and let me know how that goes. Psychiatry, the list goes on. Go deliver babies, and then you have a mother that's dying and a kid that's dying. Let me know how that goes. It takes a very special individual to do this job. And this comes down to the conversation of, is it really a calling and a purpose versus is it just a job? It's not just a job. You have to do this with caring, compassion, and heart as much as you can. However, there's a difference between being caring and compassionate to the situation versus not allowing the system to burn you out and guarding your heart. There is a difference. And that is the very thin line that we fall under as healthcare professionals, as anybody who works in a healthcare system. It's the fine line of, okay, I feel for these people versus there's no resources and I don't know how to guard my heart with this because I know that I should be doing things this way. But because of my lack of resources in the system, I can't fulfill my duties. Or I'm given an assignment that's way too heavy or have too many patients and I can't fulfill those needs for my patients. This is an unfortunate reality. And the more we go into the nursing profession, the more we get into the healthcare profession, the darker it becomes in regards to that, where everything that we studied, the realities of nursing school does not match the realities of the system, therefore creates complete confusion and moral injury for the student becoming a professional. Therefore, they're trying to figure out, I don't understand, this is what I'm supposed to do. And I want to be caring and compassionate, but I just have to make sure that all my patients' meds are given. And I also have to make sure that this person's not crashing. And I got to do all my assessments, and the list goes on. We fall into this path of machine-like work, and we don't end up actually doing it for the love of the job anymore. Keep in mind, where does it become just a job? This is where the system abuses the healthcare professional. The system gets abusive towards the healthcare professional because they understand that this is our hearts. We go through this rinse and repeats conveyor belt system where we have to completely put ourselves out there, help our patients, put all into our patients, and then after we're on the 6th, 7th, 8th, 9th, 10th patient, and I'm serious because if you're working with a nursing assistant, you can get up to 10 patients in an emergency room in certain hospitals in the province or whatnot. One province I worked in on a travel contract, I could have had up to 12 patients by myself in an emergency room. Yes, waiting to go to a floor, but still. They're still in an acute care location. Plus, if a patient crashes in the emergency room, I have to be ready to help them, just like everybody else on a floor. But at the same time, the chances of someone crashing in the emergency room is far higher than if it was on the floor. But now those probabilities are increasing because now the patients are getting so sick because we're discharging so quickly because we need the bed. So that way we kick the patient out, they get discharged, and then all of a sudden they're coming back for complications. And then we find ourselves in this trap of, we're kicking people out, but then they're coming back in, and it just becomes this revolving door of the same people, and we can barely accept new patients that are sick. We get the frequent flyers, the recurring ones that come in, and this fills up our departments. These fill up our beds, all because we cannot provide proper resources to the patient for them to properly heal, go home, and stay home, because that's where they want to be. They don't want to be in a hospital. So now we are in this continuous moral injury of, when is this going to end? I worked as a hospital coordinator, and I was the one that was plugging and playing with beds, helping with being a leader for code situations. List goes on. My job description was gigantic. And keep in mind, I actually really liked that job. It was very empowering. It was a very good leadership job. But I got to see the unfortunate evolution of the healthcare system. And this is not based on one institution. I communicated with multiple institutions across the province. So that was one of my roles, is to communicate with a bunch of institutions across the province for patients that had to come in, and they would reach out to me and I would see if they had any beds to fill them in, and the doctor would let me know if it was a stat transfer or non-urgent, whatnot. And the more I saw this this revolving door happen and I was at a specialized institution, which means that in a community hospital, they wouldn't be able to care for a patient that needed a heart attack, get a cath lab and all that stuff. They had to come to us. And if the patient came to our cath lab, ended up getting stented, but then crashed, they would stay with our hospital, which means that they took a bed and they can't go back to where they came from. And this type of system, it's very clogging for our hospital, our specialty hospitals, because if we don't have these services at every institution, what ends up happening is that we end up clogging our specialty hospitals, and our specialty hospitals end up taking on their specialties, plus they'll end up taking on the Monsieur, Madame, tout le monde, as we call it. The everybody. The lady with the hip fracture that needs surgery, I'm sorry, but that's something that can go to a community hospital. But see, this whole mess, this whole rigmarole of where people don't know this. People don't know how the system operates. So because of this whole specialty center, community hospital thing, people are going to institutions and they don't know where to go. So the person that's known with kidney transplants, they go to the small community hospital, they can't take care of them. They have to end up getting transferred over to the super hospitals, university institutions, in order for them to get properly cared for. But right down the street is the community hospital. So, but they don't know what to necessarily look for unless that nurse or doctor has had experience in that domain. Not saying that they're not knowledgeable, but they don't get as much exposure to certain cases. And this can lead to just a cluster of issues because our resources become less and the time gets long for them to get the proper care that they need. And that is another thing. It's another demonstration of the unfortunate issues that we see. Now, if we go back to this topic of the nursing profession being a job versus a calling, and I want you to take this with a grain of salt because this is what helped me detach myself from the job. Yes, I'm known as Nurse Melanie. I'm known to be a travel nurse. I'm known for that. However, one thing that I want to make abundantly clear is that before I am a nurse, I am a human. I didn't come out the womb a nurse. I didn't come out into this world with my stethoscope in my hand out of my mom's womb. No. I came into this world Melanie first, who learned how to walk, talk, and play with toys. I did all of those things before I was a nurse. Before I was a nurse, I was a dancer. I used to compete. I used to go to all these competitions. I used to have all this fun. And my identity was not nursing. Yes, my identity has evolved, and I think it's normal that your identity evolves over time. But I am a nurse as a secondary component. That is my purpose. That is my calling. And the reason why I call it a purpose and calling is because I'm sharing very specific gifts to people, teaching, serving, and healing in a job. So in the nursing profession, in the healthcare profession, and anybody who works in healthcare, you have spiritual gifts that are intertwining. That is a profession, a job, but also it's a calling, it's a purpose. These things in this job cycle, in this area, I can definitely say that if you work in a healthcare establishment, whether you're a nurse, whether you're a doctor, whether you're a PAB, an orderly, whether you're a technician, whether you're a clerk, doesn't matter. Whether even as a security guard, because listen, our security guards where I used to work at, they were helping us hands-on with patients. So when it came down to certain things, yeah, they were there. So the truth of the matter is that you have those gifts. Yes, it's just a job. But if this was something that anybody could handle, anybody would do it. But it's not. It's not. So with that being said, I do believe that this profession is a calling. Now, I came across this post on Threads, And somebody said that the nursing profession is not a calling. I said what I said. And now I'm going to bring this up because I found it very intriguing that he said that. I found it extremely intriguing, and I looked on the comments and I was like, why would he say that? This is a guy that has a following. This is a guy that, and he got heat for it. He got heat. And I was like, where's this all coming from? And when he said that, I wasn't offended. I was nowhere near offended. I just wanted to investigate more. And he ended up doing a post afterwards. To say that it's not a calling makes entire sense. I think we have a different definition of what calling is based on what this person was saying. I can see where, based on the definition that he explained here, I get where he's coming from. But for me, it is a calling. However, you have to apply boundaries to it. My calling isn't my identity. That's the difference for me. My calling is not my identity. My identity, for me, is in Christ. For me, my identity is the human that God has created for me to be. He has created me to love dancing, to be creative, to being compassionate, caring. He created me to be that way. That's a part of my identity. My calling, my purpose, is the fact that it can intertwine with my profession. But at the end of the day, there's even at that point, there still needs to be boundaries. So this is where a lot of nurses can get very mixed up, especially new nurses, because you believe that this is a calling. I'm sorry, but if you're coming out of nursing school, you're fresh with the spirit of, oh, I love this, and the honeymoon phase. You're all in that, and it's such a great phase. But also you're starting in that phase, and then you realize, oh, this is not what I pictured it. Oh, wait, this is heavier and harder than I thought. And then you get into the component of, I've seen so much and I'm burning out. And next thing you know, you're on your second burnout and you just don't care anymore. And that's the issue here. We've taken the nursing profession that was from Florence Nightingale, and keep in mind, Florence Nightingale nursing don't exist anymore. I'm going to say that right here. It's not the same. Florence Nightingale wasn't pushing propofol. I'm pushing propofol. I love pushing propofol. But we're going from a place where it evolved from Florence Nightingale nursing to getting more academic, and then all of a sudden, the academics grow, but the faith decreases because you're just getting rinsed and recycled and used and abused by a system that just thinks that you're a machine, when really that is not what you were trained to become. In nursing school, when I was trained as a nurse, I was not trained to be a machine. I was trained to be compassionate. I was trained to be knowledgeable. I was trained to be a professional. I was trained to have a heart in the job. That is what I was trained to do. That was where I started. Now, is that entirely reality in today's time? Unfortunately not. The academics is all we have left. The academics, the fact that we are a professional body, the fact that we have an order of nurses, the fact that we can take leadership is all we have left. And even at that, it gets completely wiped out. It gets completely used and abused in that circumstance. I don't think he's incorrect, because you do have to set boundaries. You have no choice. If you don't set boundaries and you don't give rest to your purpose, you will not be able to fulfill your identity. You won't be able to give it energy. You won't be able to remember who Melanie is, or whoever you are. You will no longer be the person that you have been designed to be. And I lost that. I'm saying this out of experience, y'all. I lost that. I couldn't care at a certain point. I had to pull myself out of the emergency to throw myself back in. And the minute that I pulled myself out, understood the system better with the management job that I did, I was also able to come to my faith a bit more, because that was the beauty about the other job, is that I had the energy and time to do that. even though there was a lot of mental demand, huge mental demand on that job, it was still an eye-opening moment for me to be like, I'm angry. I'm deep down, I'm angry. I'm frustrated. I'm annoyed. When I saw myself in pictures, as I pulled out of the emergency room, at that time of my life, I realized how it was killing me in many ways. I was on the verge of being hypertensive, diabetic, high cholesterol, until I pulled myself out to really reflect, because I was in chronic fight or flight mode because of this machine-like system. I just couldn't stop. I couldn't turn it off. And also, I was running a business on the side, because I knew that if I worked in the hospital full time, it was not going to be healthy for me. So I decided to go part-time. But I wanted to create something. I wanted to do something. Those things that I identify as creative, I wanted to do something. I wanted to do something more. So I did more. And I created a business. I started coaching. I started teaching. I started all these amazing things that I love, and it filled me. But then when the pandemic hit, and that you were all that the system had, you were all that the people had in these challenging times of the pandemic, I was exhausted. That was a very tiring 3 years. It was so tiring that I just didn't have the bandwidth, the capacity. It was so bad that I was getting sick. I developed PCOS. I had infertility issues. The fatigue was just out of control, the weight gain, and it's all because my identity and my purpose intertwined, while the abuse of the system took advantage of me, because I was the one that still believed that nursing was a calling. And I do believe that it's still a calling. I just think that it's in a system that sucks. I believe that healthcare professionals are stuck in a system that just does this rinse and repeat, conveyor belt, machine-like healthcare, which is what we're not trained to do. And not every single situation is the same thing. Not every single case is the exact same. I want it to be understood that nursing is 1000% a calling, but calling does not mean that it's your identity. My identity is the things that I am, the fact that I'm creative, I care, I'm compassionate, I love dancing, I love to help others, I love to teach, those are the things that make me who I am. Nursing is the secondary component and it's the purpose that comes out of that, all of those things that make me who I am. It makes me fit for the job. But we remember that this is a job that requires heart, that requires passion, that requires critical thinking, that requires knowledge, that requires experience and being fearless. We end up getting abused by the system that does not allow us to be that professional. So, with that being said, the best thing that I can recommend to people who are struggling with the fact that this is a calling or not a calling, that the nursing profession or any type of healthcare profession is burning you out, making you apathetic, my advice to you is you need to stop and reflect on what you're doing. Because at some point, yes, the nursing profession has evolved to be less of a calling and more of a job. And that's how we create an apathetic system, and that's how we lose the component of being caring. I know that this may not resonate with everybody because people may be in a situation of burnout. People may be in a situation where they've given up on the system and they're just trying to clock in and clock out, which is totally fine because you have to go into some type of survival mode in order for you to get through. And I've been there and I've done that. I had to pull myself out in order for me to heal. And then because I had such a passion for the emergency room, I had to pull myself out, heal, and then, heal to the magnitude that I can until I'm ready to go back. I'm not 100% healed. I don't think anybody is. But the advice that I have to you is to step back and look at the system. Look at the system that you're in. And understand that the profession that you love so much is not a replication of the system. They're two different things. And unfortunately, we're in a society where the system is not matching the value of the profession, whether it be the actual job description, whether it be the pay, whether it be the care that we are able to provide because of lack of resources. The list goes on. What I want to reiterate is that if you need to pull yourself back and remind yourself of why you got into nursing in the first place, do that so that way you can start healing from within and understanding that the profession and the system are two very different things. Your beautiful profession that you ever so love is under a system that's not making it caring, compassionate, allowing you to execute that. But you still have your education. You still have all the knowledge and experience and wisdom that you've gained over time. You still have your license, but at the end of the day, it all goes away. The only thing that will be remembered at the end of the day is how we made people feel. I know it sounds cheesy, but after coming out of a season of serious apathy and getting my empathy back, something that I've learned is that I can do CPR on so many patients, have a low mortality rate while working with a great team. But if I don't show any type of compassion with the knowledge that I've gained, it's not going to matter because the people are going to remember how you made them feel. The family members are going to remember how you made them feel. And it was when I started getting super agitated. And then one day I pulled back and I said, wait a second, I'm so irritated. I'm so angry. And I couldn't care less about other people. I just had to make sure that the patients were alive. And that's when I realized that I have a huge problem. Because then that started pouring into my everyday life. So I strongly suggest that when you get into this job and the realities of it, and you understand the realities of nursing, you understand that the profession is still your calling, the system is not. You'll be able to find a little bit of love for your job again. When you become so apathetic to the point where that spills into your personal life, and then you just become a machine in your personal life because you become this chronic fight or flight machine of just CPR, okay, on to the next CPR, okay, saved, okay, on to the next CPR, dead, on to the next. That's what it becomes. Couple of tips. Make sure that you see a therapist once a month, once every 2 months, whatever your discretion is, but see a therapist. Recommend that you find an outlet, you guard your heart. You understand that, yes, this is a job. Yes, you are also called to do this job. But boundaries need to be set to protect yourself. And remember your identity. What do you like to do? Who are you as a person outside of being a nurse? Who are you? And what are you going to do for the people to serve them outside of nursing? What are things that you enjoy doing? Do you like going for runs? Do you like going to coffee shops? Do you like reading a book? What do you like to do that fulfills you? Those details will help you guard your heart. And remember that the system that your calling is under, it'll protect you from the abuse of the system. Also, diet, exercise, drink your water, and pray to the Lord. That is my biggest recommendation. So what I'd like for y'all to do is I want you to journal about this. I want you to journal about whether you believe that this is a calling or it's not, and I want to hear your thoughts on it. This really sparked an interesting conversation, and when I saw this thread, it really exposed to me how many nurses out there, healthcare professionals, are just so fried and lose the awe of the job. I want you guys to journal, as your journal prompt will be, is this profession, is your profession a calling, a purpose, or is it just a job? And are you able to separate your job, your calling, your purpose to your identity? Do you believe that your identity and your calling is the same thing? I'd love to know, because for me, it's not. For me, it's not. Yes, it takes every fiber of my being to be a nurse, but on the clock. When I'm working as a nurse, when I'm serving clients, but I have to turn that off. So how do you turn that off? How do you recover? So with that being said, thank you so much for tuning in. Thank you so much for being here. Do me a favor, y'all. Like, comment, subscribe. Go on to nomadicnursenetwork.com and subscribe to our newsletter. Get all the updates. Also, check out the services that we have going on. We got some healthcare services for patients that I think y'all would like. And plus, we are working on creating a community for healthcare professionals to help them develop into their calling, their purpose, but also to make sure that they prevent burnout. Yes, y'all, you can love the job and call it a calling, and you don't have to be burnt out. How do you protect yourself in that moment? We're going to be talking about all of that. Without further ado, thank you so much for being here. Thank you so much for hearing me. And I hope to see you next time. Bye.